I am a pediatrician working in a sub-divisional hospital. Today I am going to tell about hygienic habits in children. First of all, at the outset, I thank Baby Chakra for giving me this wonderful opportunity to interact with children, their guardians, parents, and all of them who are watching this program. We are extremely thankful to all the viewers of Baby Chakra who are watching this program right now. First of all, what is hygiene? Hygiene is something that prevents us or our child from getting an infection or from a bug. As we all know, in this corona pandemic, hygiene has got prime importance because of its, uh, what is the mortality and morbidity of diseases, especially in under 5 children and other age groups. So all these bacteria, virus, and fungus, they are always looking eagerly to enter into our body through our skin, our orifices, nasal cavity, oral cavity, nails, skins, etc. So only our hygienic habits prevent them from entering into our body and save us from deadly diseases caused by those bacteria or viruses. There are numerous n number of diseases which can be caused by all these organisms, and only our good hygienic practices can prevent them from getting an infection. So, what is a hygienic habit in the children? So, hygiene starts from home, school, our offices, or creches, or play schools, wherever our children are going, or wherever our children are interacting with other peoples or other children. Hygiene is different from different age groups. Like in infant, it is different. Like in a preschool, it is something else, and in school going children, it is something else. So hygiene can be of different types, like hand hygiene, oral hygiene, skin hygiene, etc. and etc. So what is ideally we have to do? Oral hygiene, we should advise our children to brush twicely a day, preferably with a soft brush. And if he is having a sensitive gum or a bleeding problem from the gum, we can use our hand, or you can advise the baby to use his hand to brush the teeth. And we should also brush our tongue twice daily. If not possible with a tongue cleaner, with a brush also, soft brush, we can brush our tongue also, and it should be done twice a day. After taking some meal or dinner, or taking milk at night, we should always advise to brush our teeth and rinse our rinse the child's oral cavity, because the bacteria, they have a tendency to get deposited inside the teeth cavities and inside the teeth, and cause caries and other teeth problems. So, how to maintain the hand hygiene? Hand hygiene, as we all know, it hand washing is the most important factor in preventing bacteria to enter into our skin. So, what is hand washing? Hand washing should be done before going, or before going to school, or after coming from the school, or before the child is getting attend a class, etc. So, what are the different steps of hand washing? Hand washing is very important according to WHO, World Health Organization. He has fixed it, like it should be done within 20 seconds, and there are 6 steps. I will show you how to do a hand washing uh, as prescribed by World Health Organization. First, we have to use a liquid soap, and ideally you should use a elbow operated tap, or in a small baby is there, you can use a tap, but we should have a liquid soap and a tissue paper. So what are the 6 different steps by which we can do hand washing? First, we have to rub our hands like this. This is the first step. Then we have to interlace our fingers like this, so that the inside of the finger gets disinfected, or the organisms are got washed away by this. Then dorsum of our hand like this we have to do. First one hand, then reversely we have to do. Then we have to do like this. The knuckles or the posterior surface of the hand like this, one hand and then the other hand. Then our thumb, because this is a very important area where the bacteria and the organisms can lodge. We have to do like this. First left hand, then right hand. We have to do like this. And another thing, the nail beds. These are the important areas where usually there is a, when the child is having putting his mouth inside the teeth or is touching any fomite or object, things are getting lost inside the nail bed. So you have to wash like this, clockwise or anti-clockwise, then anti-clockwise, both hands like this with a liquid soap. So these are, and another is wrist, because this is also a good area. Some bands or watch is worn here, so you have to remove the watch and you have to wash like this. So after the baby comes from, our child comes from school, parents must ensure that you have to wash his hand as I have recommended or as per the recommendation of the WHO. And another important thing is cutting the nails. Nails should be trimmed twice a week. The parents must look that the nail should not outgrow the fleshy area, so that the organisms get lost in that nail bed. And another thing is that skincare, we should give our baby a regular bath, ideally with an antiseptic or an antiseptic soap. uh, Depending on the climate and the environment, actually we have to give bath every day with a lukewarm water with an antiseptic added to it. After that, we should also trim his hairs, and head bathing we should do once in a week. This is of utmost importance, because all the organisms they get lost in all these areas. The underwears and the inner wears, they should be washed every day after the baby returns from the school. It should be washed. If the baby is going to a gym or is going to a for swimming, then once in a week the swimsuit and the gym suit should be washed. The remnants of the tiffin, the child is taking a tiffin to the school, so remnants of this food material should be washed off from his school bag. And care should be taken to wash the bag at least once in a week, so that the food materials are not lost in the school bag. The food materials are not lost in the school bag. Another thing is that sometimes the baby comes drenched from the school as this monsoon season, and there is every chance that there may be heavy rain and the baby may get wet. Especially take care of the foots. The shoes and the footwear should be removed before entering into the house, and both the feet should be washed with a antiseptic added water. Ideally, it should be lukewarm water before entering into the house. So this is the skin hygienic care of the foot, hygienic care of the hand, and hygienic care of the uh, body. Another thing, always every child has a tendency to take food outside. Usually the junk foods, chow fried foods, deep fried foods, etc. So care should be taken that the junk food should not be taken more than once in a 15 days or twice in a month, because these foods are usually bad for the health. It contains fat and sugars in a wrong proportion. So now we will discuss some questions. What are the things that as parents we have to be careful about when kids go to school? So three things we should take care of our baby before when the kids go to school. First, they should carry a hand sanitizer in a small amount in his uh, backpack, so that he can sanitize his hands before and after each session or each class. Second thing, he should wash his hands and feet before entering into the house when he returns from the school. Another thing is a cough or sneeze hygiene, that he must carry a handkerchief before and he should use it before sneezing, or while he is coughing he should use a handkerchief so that the droplet infection does not spread to other babies. Another question: my 7-year-old does not wash her hand or bath after coming from school. She will directly eat once home. How can I manage this? Now, one thing, good habits develop as soon as possible. Parents must take care that good habits develop in a child early. So there is no age limit, or we cannot wait until certain age limit. It should start directly, and you should be the role model. A parent should be the role model. Babies are good mimicker of the parents, and if a parent washes his hands and washes his feet after when he comes with the kid, then obviously the kid will follow it. One thing, at least after coming from school, he should wash his hands and feet. So, third question: what special hygiene care should I follow for my 6-year-old during school times? As I have told, care of the hand, care of the foot, sneezing and cough etiquettes, and avoiding touching unnecessary things, and washing, using a antiseptic whenever he touches or he returns from school, and maintaining social distance. Is giving sanitizer to kids in school safe? Why not? You should take a sanitizer, but care must be taken that he should use it only when it is required, and small amount of sanitizer in a small bottle can be given. What are the after school hygiene practices that are a must for kids? Must for kids is he should always take care of his hands, because it is the importance prime area of the body where usually the infection starts. And he should not unnecessarily touch things which are not required. He should not put his fingers inside the mouth. He should not chew the nails, and nail must be trimmed twice a week. He should wash his hands as I have shown. He should wash his hands and feet with a antiseptic soap or a liquid soap before entering into the house while he is returning from the school. And he always should, care must be taken that parents must give him a shoe before, because if he walks naked on the road or outside, there is every chance that he might get a worm infestation. So shoes, wash your hands, feet, always take care of your sneezing and cough so that you should not infect others, and also cover while others are sneezing, and unnecessarily don't touch any of the food, any things which are not required, and always maintain social distancing. Thank you. So, take home message is good hygienic habits should be developed as early as possible. Parents must incur these habits into their children or into their child as early as possible. They should be a role model, and they should always communicate what are the bad effects. If you are not maintain a good hygienic habits, what are the bad effects? Always communicate with your child. Always take care of your belongings. Always advise the child to do hand washing before eating or before after coming from school, and always check whether he is maintaining this good habits or good hygienic habits or not. Thank you.